Today we're going to be talking about aneurysms! Aneurysm is an abnormal stretching or dilation in the wall of an artery, vein, or heart, with the diameter of the vessel reaching at least 50% larger than normal. There are two types of aneurysms: true aneurysms, where all layers of the vessel bulge, and false aneurysms, where there is a hole in the vessel causing blood to pool and look like a true aneurysm.
Inadequate oxygen reaching the walls of the tunica media leads to the loss of smooth muscles in the vessel as well as the breakdown of elastic tissue. This causes weakness in the vessel walls, and the pressure within the vessel cannot be maintained. This pressure increase leads to an increase in the lumen diameter and is a continuous cycle of bulging of the vessel. Aneurysms occur more often in men than women. Incidences can occur more frequently after the age of 50, presumably due to chronic inflammatory cellular changes that result in atherosclerosis.
Aneurysms can lead to the compression of the branches of the aorta, as well as a myocardial infarction, reversible ischemic neurologic defects, stroke, paraplegia, renal failure, intestinal ischemia, and ischemia of the upper and lower extremities.
Some risk factors include being a man between the ages of 40 and 70, having high blood pressure, and getting older. Having a family history of aneurysms makes it 4 times more likely for individuals to be at risk due to defects on chromosomes 11 and 15. Other risk factors include mutations that lead to the transformation of beta receptors, having Marfan syndrome, injuring the tunica media, and atherosclerosis.
Someone with an aneurysm will experience persistent substernal, neck, back, or jaw pain. Aortic aneurysms may be experienced as extreme, sharp pain felt at the base of the neck or along the back and between the shoulder blades.
You should contact your doctor if you're experiencing throbbing chest pain that increases with exertion or find a pulsing mass. If the aneurysm ruptures, you may experience sudden and severe chest pain with a tearing or ripping sensation.
The aneurysm has been removed surgically. The patient will begin by working on bed mobility. This also prevents thromboembolisms, also known as blood clots.
In order to diagnose an aneurysm, palpation of the suspected area or an X-ray is usually done. Since aneurysms are mostly asymptomatic, they are usually discovered by accident. Aneurysms can also be found with other imaging techniques such as CTs, ultrasounds, arteriography, aortography, or radiographies.
Ask your doctor, pharmacologist, or local drug dealer for statin to lower cholesterol and beta blockers or ACE inhibitors to control blood pressure. This will help prevent aneurysms from growing or bursting.
Activity should be restricted and slowly introduced after removal of an aneurysm. The patient may experience increased blood pressure and must be monitored closely. Engagement of the abdominal muscles and deep breathing can become painful due to pain at the incision site.
Ouchie!
Proper lifting technique should be taught and weight limited to 10 pounds for 6 to 10 weeks after surgery. Before mobilizing tissue on a patient's stomach, the therapist should feel for a throbbing mass and use caution as they proceed, especially if the patient has a family history of aneurysms.
Brought to you by My Nips Are Hard Productions.
Roll call!
Melody.
Brent.
Amber.
David.
Shawnee.